Hi, my name is Stacey and I'm the training manager here at Skin by Lovely. And a common question that patients have for me, especially if they're nervous for doing their injectables their first time, is if this was your mom or your sister or your best friend, how would you treat them and what would you recommend as a good treatment to start off with? Today I actually have the privilege of treating my mom. She's a great example because we have a 30-year age difference. I'm 37, she's 67, and so we can see how aging progresses and what we can do to prevent and also treat the process of aging. Hi, so we just finished her liquid lift. We did 8 syringes of dermal filler, so just to show you kind of like what 8 syringes looks like. Very natural aesthetic, doesn't look overdone at all. There will be swelling for about 3 to 4 days, so that's totally normal. But for instance, like the lips can swell the most, and a lot of people get scared of how swollen they can be, but that goes down a lot. We did less than the size of a blueberry in her lips. So just to give you an overview of what we did some wrinkle relaxers to lift her brows. That hasn't kicked in yet. That takes about a week to 2 weeks to fully kick in. We did a little bit for her forehead lines, a little bit along her crow's feet here to open her eyes. We also did a little bit in her neck bands. That's going to help tighten her neck in a couple weeks. We also did a little bit in her actual neck for the crepey skin in the neck, so that will help tighten in a couple weeks as well. And then we did her derma filler, so we did some temples, so you can see that helped fill in the hollowing she had in her temples. Also gave her a little brow lift. We lifted her cheeks and repositioned her cheeks upward, so that way it softened her nasolabial folds and marionette lines, gave her some nice contour. We did a little bit in the back here of her jaw to also help facilitate the lifting of the neck and the lifting of the jowls in this area. We did her marionette. We filled in her scar she had here. She had from Mohs surgery a deep scar. We filled that in with some derma filler. We did just her lip borders just to soften her lip line so the lipstick doesn't bleed through the lines onto the upper and lower lip. And I think that's about it, right? Yep. So this is what, wrinkle relaxer and then 8 syringes of filler looks like. Each syringe is about the size of a blueberry, so it's very little. So nice natural aesthetic. But when you're in your 60s, almost 70s, I would expect, if you haven't had ongoing treatment, to do probably around this much to have like a nice liquid lift. So, thank you for watching.